Hi everyone. So my April 14th surgery date postponed until yesterday, 19th of April, to remove epithelial ingrowth cell from my right eye, cornea flap and stroma. And it's been 2.5 months, a little bit over 2.5 months after my traumatic cataract and second vitrectomy. So my Lasik, which is cornea flap, dislocated, and doctor put it back, but I think it wasn't good position. So that's the reason epithelial ingrowth cell grew, and that gave me distorted vision and stigmatism severely, so I couldn't focus it. So finally, my busy cornea doctor specialist found the date, which was 19th yesterday, so I got the surgery done. Excuse about my right eye because it's stinging so bad. Among all, this surgery, yesterday's surgery was my fourth surgery, and this is the most hurtful surgery because Dr. Cornea specialist scrape off that ingrowth cells from stroma and back of cornea flap, and I guess it was a lot. So he scraped off. Surgery was about 40 minutes, and at the surgery center. So I'm not going to mention about who's my surgeon or whatever. I'm grateful that he get to do this, but I'm the sixth patient who he is performing this surgery, so I think it's uncommon surgery. I hope that's even better because I don't want anyone else to go through this, but I wasn't looking for anyone else. In patient's point of view, healing and pain experience wasn't anywhere to find at YouTube or online. I see so many doctor posted YouTube and online about how to remove epithelial cell from cornea flap and stroma, but patients mentioning about healing process is none to exist. So I hope I don't want anyone else to go through this, but again, if in the future anybody go through my symptom, then hopefully they know what is normal and what is abnormal. So yesterday was surgery. Pain was so stingy. I never felt stingy pain like that. Maybe that's why doctor gave me gabapentin. So this medicine for pain killer, top of Tylenol, but this one, watch out you guys. I took this one, I got nausea, vomiting feeling, and dizziness, dry mouth. I took twice because doctor prescribed it. I took twice, then I gave up, and today I went to see one day post-op at the hospital, and I told doctor, it was like junior doctor who saw me because, you know, this special cornea specialist is way busy. The lobby was full of patients. So I understand I don't need to see him. If anybody can take off my bandage. So I told doctor, I asked doctor if this is for painkiller. I don't need that. Tylenol will work a lot better than this one because more painful to take this one than subside pain. So, you know, if you guys have any kind of allergic reaction to this, please don't take it. So that, and today that junior doctor, I don't know, it wasn't specialist, cornea specialist, but another doctor saw me, took up my iPad and tapes, saw my eyes, and it's there is no more cell in there because I asked him if he see any ingrowth cell. He said no. So, and doctor did stitch all around it. So it's not like each stitch like I watched on YouTube, but it's all zigzag going all around the eyes. And one stitch going zigzag all around the eye, that's the most advanced stitch for cornea flap attachment. So I believe him. And he asked me to start my prescription eye drop, moxifloxacin, and my best friend by now, prednisolone, both 3 times a day, and no preservative lubricant eye drop, you know, this one 4 times a day. But these two stinging so bad for 5 minutes, actually this one maybe 3 minutes, stinging so bad, but this one 5 minutes, full 5 minutes stinging, and I like tears coming out of both this one too. As soon as I put the drop in, tears comes out. I don't know if this one all washed out with tears. I never felt that stingy last 3 surgeries, but this surgery, cornea flap epithelial ingrowth cell removal from stroma and back of cornea flap, is the worst painful. So I call after I put drop, came back from post-op and putting in, and it was hurting so bad, stinging so bad. You know, after 3 other surgery prior one, my pain endurance is high, and also I wanted it. Even this doctor asked me if it's too painful, he can put the bandage contact lens on it, but I studied if I use bandage contact lens, then it heals. Healing is delayed. So I confirmed with him. He said that's true, and I have to take it out after 3 days, go over there. So I told him it's whichever, you know, hurting I can endure. So I will go cold turkey. No contact lens. But when I put this one, it was so stingy. So I called them after first. This one was fine. This one steroid. This one is even, I feel like soothing kind of feeling. So I love this one. Actually, it feels soothing, right? But these two is the killers. Anyway, so sorry, my nose are running. It's still like coming out. So I left 3 messages to answering machine. I don't know, I mean answering service or whatever the number they gave me. I called, so they are supposed to call me back. Guess what? They never call me. 5:50 I call back, and Anyway, long story short, finally I talked to their attitude was so bad. I don't know, you guys. You know, these days, if you get old and get any health problem, do I have to just be quiet and just wait until, I don't know, just, I don't want to say it. Okay. It's just like there is nobody really care. They say call immediately if it's stinging and eyes puppy, then call their office. When I call their office, nobody really returned my call. So finally I called their emergency line, even that somebody who answering emergency line, answering service, I think, giving me attitude, and she got upset that I asked her, do I have to explain to you for the fourth time? Then she said, oh, I cannot talk to you. Then finally connect me with the doctor. It's third doctor. It wasn't, of course, not a surgeon. It wasn't Dr. Iso, but the doctor from that office answered the phone, and I asked, I understand it's going to be stinging because they scrape off the cell from my stroma and cornea, but I just want to make sure before I put the drop again, it's not hurting my vision in the future. This antibiotic stinging so bad for good 3 minutes and tearing up, and this one too. And she explained to me that, yeah, that's okay. That's how simple it is, that I just wanted for them to double confirm that it is okay. That's the normal. Like nobody, no surgeon or no doctor told me it's gonna stinging that much, right? Like this medicine they gave to me for pain relief, it gave me vomit feeling. I didn't vomit it because it's gonna be bad for my eye, and nausea, dizzy, and all that. I didn't take it because I didn't know if it was going to heal my eyes. I don't think so, because when I read online, it wasn't anything to help with my eyes. But who knows? Doctor prescribed this. I'm by the book. If they tell me to do so, I wanted to do it. But they told me, the doctor today told me, if I'm okay with the pain, I don't need to take this. I don't know. This is, seriously, this is, I even thought doctor prescribed for wrong medicine. This one, I don't know, made me really sick. So I wanted to make sure, because it's my eye and now I have to get better. Like, you guys will think I'm crazy. Seriously, I think, because everybody treating me like I'm like very sensitive. You know, it's my eyes and it's my fourth surgery I want to see. And my cornea specialist, he's good that he did it, this surgery. I appreciate it, but he didn't say anything for 2.5 months. Every time I see him, he never said anything. Anyway, so, which is good. I studied a lot online and I read a lot, but when they prescribe these things, that I like to take it because it's very important for me not to get infection in my eye, right? I want to take it, but is that much stinging is okay, because there is a lot of side effect that if I get that kind of symptom, call the doctor immediately. So anyway, I'm taking this, and hopefully somebody who answered the phone today, emergency line, she said that it will be better and better every day. Of course, because my eye will heal and it's gonna be better. So somebody should have told me that before I left their office. they think I should know everything. I don't know. I don't know. It's just I feel so sorry for any patient who's even older than me sitting at the lobby. I don't know if they explain that to them or they don't even have a question. Like at surgery, this nurse putting the IV line here, it was hurt. Look, you can see that how my vein and this poke, the needle poke is so off, so it was keep hurting because I had two sons. I had to, and they born with C-section, so I got lots of IV. At that time, I know once needle go in there, it shouldn't be hurting afterwards, but until I, for a while, it was hurting so much, like pinching every time, pinching, right? So I had to tell nurse at my surgery was 6:30, so a.m. because doctor has to see the patient that day. So I had to be at the surgery center 5:15. I'll be there at 1 a.m. if I have to because I really want to get this epithelial cell out. So I went there 5:15, got in 5:30, and 6:30 was my surgery, and she did that. So I told her it's not, something is not right because it's keep hurting. So she took that needle out of there and she put it on here. So after that I was fine. And anesthesia, my surgery was 6:30 and anesthesia doctor arrived at 6:40. So even though it's just 10 minutes, every second goes, lying down on waiting bed before I ship it to surgery center. Every second I'm just so nervous. I don't know, this is my fourth surgery, so I shouldn't be so scared like that, but it was most scared time. Even before the surgery, I prayed. Maybe I'm sinning because I don't have enough faith to be calm. But every second goes by, I'm more scared, So surgery started at 6:30. It lasted about 40 minutes. Of course, there are a lot of cells, I think, because it's been 2.5 months. So scraping those off. And I just want you guys to know epithelial cell, if it's grew a lot on the stroma and cornea flap, it hurts. It's like stingy feeling. It's like you have a wound, on the knee. Or skin is off and somebody put alcohol on there. It's that stinging. And it subsided a lot today. Like right now, I took 2 Tylenol again. So I'll keep taking 2 Tylenol, but I'm usually don't take any medicine. So hopefully I don't have to take it anymore. But I wanted to update you guys. About my vision today when I visit doctor. Of course, I cannot see through this eyes. I see it, and there is no cell I see on the bottom, but it's very blur, but I can blur everywhere, not only on the bottom, more bottom on the bottom. Does it make sense? I don't know, I'm a little bit off today with all this. Still that anesthesia medicine is still on me. I don't know, all this kind of frustrating event for today, and my eyes are like so stingy. So, but I wanted to update on my epithelial ingrowth cell removal from back of cornea flap and stroma is very stingy hurt, and that's normal. And I'm going to take antibiotic, steroid, and for the lubricant, this one, even though it hurts, and I will update on next video how my vision will be. Today, through pinhole, I could read some reading chart, and doctor told me my vision will come back after I heal this. I don't know, nobody knows how long it will take to heal this mess, but I know it will heal. So I'll update you guys. Be strong and smile. Thank you for listening my venting. But it's all good. You know, people make mistakes. As long as my vision comes back and this is my last surgery, I'm grateful. Even though it's not perfect surgery, I'll be still grateful because that's what I have to be. This whole experience made me very humble. And no matter what, God is always good. I'll be strong and I'll prevail, and I'm never going to quit. Thank you so much for watching. At least making this video make me feel so much better. I wish somebody made this video before me so I could watch it and could ask some questions. Hopefully, I pray for all of you guys not going through any of these symptoms that I had. But I know God has planned for me. I'll be strong, and I'll get the good vision someday, and so I can have another testimony from God. So that's my prayers. Take care. Bye. Bye.